Yes.
Afternoon, everyone, both here and watching remotely. My name is Nicola Leahey, and I thank you for giving me this opportunity to present my closing statement, which I've entitled, Blood is the River of Life. Some might say that we're nearing the end, but for us, it will never end. This tragedy has changed our lives, shortened lives, lost our futures, tainted our spirits, made us mistrust and lose confidence in ourselves and others. I was infected with hepatitis C following blood transfusions in 1975 and/or 1980. I was only diagnosed in 2009 and received the horrific treatment of ribavirin and interferon in 2010 and consequently suffered the life-changing effects. I felt that my body had been absolutely violated, that I'd been physically and mentally abused, stripped of my dignity, my self-esteem diminished. I mourned my lost opportunities. I felt betrayed. I lost faith. But I discovered you lot in 2018. It was so wonderful to meet others in the same situation, sad but wonderful, who understand the worry of uncertainty, the fear of the unknown, the stigma, the guilt of surviving when others lose the battle. We are united, thrown together through no fault of our own by one common theme, contaminated blood. I have read, researched and listened. I have learnt a lot about the illnesses, about fellow victims, about people, those in authority, about organisations and about myself. Just prior to my diagnosis, I'd taken early retirement because I'd lost confidence in myself because of the lethargy, the brain fog, and generally losing myself. The power of this community and the support networks have been a lifesaver. Now, with the greatest respect, I have come to realise that the vast number of personnel involved in this inquiry and beyond have had the security of wages and salaries because of our plight. Many of our community have been denied that privilege of education, careers, furthering careers, and the security that goes with it. We have not had that security of a life free from anxiety, pain, suffering. Instead, we've had the uncertainty and fear of the future and eventual death. Yet, all we ask is to be treated with empathy, respect, and dignity. We shouldn't be made to feel like beggars, receiving handouts tossed to us whenever or however the powers that be make that decision. Our predicament, through no fault of our own, has now lasted for many decades. Unnecessary suffering and numerous deaths, consequential medical and psychological trauma, medical and administrative failures, failed promises and knockbacks. No wonder our faith and confidence in the very constitution of our country has been shattered. The inquiry has produced a mass of statistics, but as I well know, because statistics was part of my job, data is meaningless without the facts behind the figures. The facts are here. The people, the lives, the deaths, the suffering, the injustices. We have long awaited recognition and action, and we now need to have our confidence in fairness and morality restored. This inquiry has highlighted so many areas in need of change and improvement. Some are to such an extent so obvious, and that's what makes it so infuriating. I truly believe that the evidence heard has proved that this has been a multi-system failure that has categorically been allowed to fester and grow, much to our detriment. In my evidence in Leeds in June 2019, I spoke about lessons learned. So please, let's learn from what has been termed the worst tragedy in the NHS history. Lawrence. My recommendations fall into three categories and relate to communication, education, support, finance. I'll start with the recommendations that I'd like to see in relation to communication. The establishment of improved communication between all healthcare providers. I am aware that at least 20 years ago, a national electronic system was planned, which would connect all institutions and departments for all health information to be accessed wherever we are nationally. Yet we still have big gaps of patient information being available and shared. Surely, in this day and age of technology, we should be capable of having a national and indeed an international system. Number 2, the establishment of a patient passport for all hepatitis C and B patients, HIV patients, and all recognised associated conditions. These are already in existence for cancer, diabetes, cognitive problems, and other conditions. This would alleviate the stress endured by the constant worry of what is now happening to our bodies. We have been ignored in the past, which has increased the time between diagnosis and treatment and therefore contributed, in many cases, to early loss of life. Number 3, the establishment and support for freedom to speak up initiatives within all departments, both governmental and NHS. The inquiry has highlighted the lack of acceptance and encouragement for personnel to feel able and confident to voice their concerns. Number 4, the establishment of clearly defined policies that should be implemented, adhered to and audited. During my career in the NHS, cut short by the effects of hepatitis C, the difference between policies and guidelines was distinctly laid out. A guideline is a should. A policy is a must. A policy is a must. I have observed during the inquiry hearings that the lack of clear policies has given people in positions of responsibility the opportunity to individually interpret and perhaps disregard important decisions relating to the quick and timely identification of treatment of diseases and their effects. Number 5, the production of a flowchart. Simple flowchart describing the process for seeking advice, support and application for medical and financial assistance once diagnosed with hepatitis contracted from infected blood. This would signpost the infected patients to where to seek medical records and evidence and how to join the support groups. Also, importantly, it would assist the medical professionals in identifying patients and the process for the treatment and the support available from the relevant schemes. Victims' evidence has demonstrated how the lack of clinicians' knowledge and awareness has caused needless stumbling blocks, resulting in delays and frustration. Lawrence. My second set of recommendations that I'd like to see are in relation to education. The establishment of continuing education and awareness, especially for the medical profession and supporting professionals. It is essential to recognise the importance of treating patients as individuals, recognising and accepting that the patient is more than likely be the expert of their own body, their feelings, etc., whilst the medical professionals are the experts in caring for that body. And if I may, I suggest educating all healthcare professionals in the skills of communicating with patients in an individual way that can be understood. That can go down now, Rance, thanks. Teaching and observing the way that professionals inform patients of sensitive and bad news. How many times have we had this bad news given to us in inappropriate places? Teaching the art of encouraging patients to ask questions and giving them the opportunity to be part of that pathway of care. Teaching and practicing the principles of the duty of candour, along with the importance of openness and transparency in all healthcare settings. This has so much been an obvious omission in a lot of the evidence that we have heard. Now, education in new research is a component for continual professional development. One of the examples of importance of research findings that we've heard was research findings were not being widely distributed and shared with the right people, and it was the lack of awareness and the best practice to reduce the number of unnecessary blood transfusions. Teaching the importance of record keeping, documenting why a treatment was required and informing the patient of the reason for that decision. Raising awareness of the importance of recording all decisions, and that it is just as important to document why something was not done as well as documenting what was done. And that is so important, documenting why they didn't do something. Teaching and raising awareness in the taking and documenting of consent. Teaching the importance of the correct, comprehensive recording of information on death certificates. Something else that we keep hearing about. Teaching and raising the awareness of recording and auditing and learning from such things as adverse events, serious incidents, and near-miss incidents. That's education. Now, my final set of recommendations that I'd like to see are in support of support and finance. The establishment of a universally agreed policy approach to the ongoing medical and psychological support for all victims, thus ending the postcode lottery that now exists. People should be entitled to the same level of care wherever they reside. We need to have reassurance and confidence in the very same healthcare system that has failed us. There needs to be a better understanding of the importance of the patient's ongoing welfare. The patient requires that continual reassurance that everything is okay. There are many patients like myself who, following treatment, have been declared free from hepatitis C and then discharged with no more regular follow-ups. But how do we know that our liver is not further deteriorating or that we have developed liver cancer if we don't have regular ultrasounds or fibroscans? I have regular blood tests to allay my fears, but not all victims have understanding GPs, and I would definitely like to see it as a normal occurrence for us to have regular, once-over checkups, similar to a well man checkup. Surely we're owed that. Number 2, the commitment to secure future funding to organisations such as the Hepatitis C Trust to provide the essential ongoing support for victims. Their support, advice, and just being at the end of a phone has been so beneficial to so many. Also, I must say that the Hepatitis C Trust Zoom meetings are so much appreciated. Number 3, the establishment soon of a funded initiative to get the whole nation tested for hepatitis C. We've heard about the look-back exercises in some parts of the country. Why not everywhere? Why not now? Again, it demonstrates the importance of documentation in patients' records, as well as the importance of accurate and complete communication between secondary and primary health clinicians. Number 4, the establishment of an arm's-length body to manage the process of assessing and paying the compensation agreed. This was recommended in Sir Robert Francis's report, but nothing's been heard of it. I feel it is imperative that this body be professionally led, trained in the history and the life-changing impact of the tragedy, and understands the necessity to act swiftly to reach a satisfactory conclusion with empathy and respect. Number 5, to establish further interim payments for all the infected and affected people, especially if the final settlements are to be in the distant future, a future that so many might not have. Number 6, the establishment of a robust administrative system to honour and guaranteed for life in legislation the continuation of the regular financial support, thus providing reassurance and security. Number 7, importantly, the recognition and inclusion of all those infected and affected by contaminated blood, the self-clearers, the bereaved parents, the bereaved children, and those infected after the deemed cut-off dates. Thanks, Lawrence. Now, questions to be considered. What next? Are we yet again going to be fed empty gestures and left waiting for responses and action, therefore prolonging our anxieties? A government minister said, time is of the essence, so that should be honoured by a timetable of updates detailing the progress of the implementation plans. Another question, would it be possible to see the final report before the press and the public? How can we keep in touch? The camaraderie that has been developed has been so instrumental in the survival of many of us. Now, I'll finish by saying something positive. I've made some wonderful lifelong friends for which I'm eternally grateful. I thank you, Sir Brian. Like so many others, I have appreciated your compassionate, respectful, dignified manner. Now, it's funny, actually, that what you've just done, because we watch, we wait for you to peel back your mask and then ask your cleverly composed questions, even though you don't always get answers. I thank all the inquiry team and support staff. I have personally appreciated Catherine's regular Zoom catch-up meetings, so valuable to keep in touch with people, to hear people, to let people feel relaxed that they can talk. I thank Jenny and the legal teams. I fully appreciate that how it must have been challenging and harrowing hearing the tragic accounts of the infected and affected. But most importantly, I must say, I thank all my friends and my family for the support that I've received. Now, I've stood here with a beating heart, somewhat rapid, but I'd like to honour and remember those of this community that unfortunately through no fault of their own, do not have beating hearts anymore. Thank you.
One of the submissions which was made to me earlier this week, and indeed on paper, is that I should see things in context, because actions and words can mean different things in different contexts. You've given us a perfect example of that. You've asked for people to be respected, yet you call them you lot. But from you, it's affectionate.
Yes.
Thank you very much.
Thank you. Sorry.
So just to say what we have coming tomorrow, we will have Mr Aldworth and Mr Robinson on behalf of the Belfast Health and Social Care Trust and the Northern Ireland Blood Transfusion Service, and we expect to conclude by lunchtime.
So tomorrow, 10 o'clock, Northern Ireland.